Hello, my name is Mike.
And I'm Magdalena.
My name is Karrie.
And we did Chapter 49 in Neurological Disorders.
The basic anatomy of the nervous system is comprised of white matter, which is myelinated axons, gray matter, which is referred to as the cortex, and that contains nerve cell bodies, dendrites, and axon terminals, as well as unmyelinated axons. The brain is encased by the skull and three membranes, the dura mater, arachnoid membrane, and the pia mater, all surrounded in cerebral spinal fluid. There are 33 vertebrae that form the spinal column that protect the spinal cord. Nerve cells, or neurons, are an important part of communication in the body. A neuron is comprised of a nucleus, an axon, and dendrites. The dendrites bring information to the cell, and the axon transmits information out of the cells to the destination or organs. The central nervous system is comprised of the brain and spinal cord. There are two systems, the central nervous system and the peripheral nervous system. The peripheral nervous system has sensory input and motor output that is divided further into the somatic or voluntary control, skeletal muscles, and the autonomic, the unconscious regulation of bodily functions like respiratory rate and heart rate. The sympathetic nervous system activates the fight or flight response, and the parasympathetic activates the rest and digest response. Some common neurological disorders are neural tube disorders. One of the more common types is spina bifida, which is Latin for divided spine. This occurs when the embryonic structure that forms the brain and spinal cord is malformed in utero. Folic acid is recommended as a prenatal supplement to decrease this incidence. The next is cerebral palsy, which is a non-progressive disorder that affects motor neurons, creating spastic hypertonic muscles with dramatic deep tendon reflexes. The different kinds are dyskinetic or ectoid, which is worm-like movements, or ataxic, which is a wide gait and difficulty with fine motor skills. And then there's mixed type, which is ectoid or ataxic and spasticity together. The next common disorder is inflammatory disorders like bacterial meningitis, group B strep, and botulism. Following that are inflammatory disorders like carpal tunnel, facial palsy, which is the paralysis of the seventh cranial nerve. Then you have proximal disorders, which are recurrent seizures. Following that is ataxic disorders, which are the failure of muscle coordination and improper muscle action.
The next section is assessments. The assessment begins with taking a thorough history. So this includes asking information about the chief complaint. So examples of this with a child with signs and symptoms of a neurological disorder may include seizure, loss of consciousness, delay in certain developmental milestones, or clumsiness with these tasks, headaches, and other symptoms. Then we move to past medical history. So we would want to find information about if mom had an infection during pregnancy, if there was a difficult birth, difficulty initiating respirations at birth, or any head injuries from a fall or injury. And then the last piece is the family medical history. So we want to ask if anyone in the family has had a history also of headaches, migraines, seizures, or other neurological problems. Next slide. Next we go in to do a complete neurological exam, which can take up to 20 minutes, so it is difficult to keep the child's attention at this time. There are 6 main areas that need to be assessed, which I'll go into further detail in the next slides. But as I mentioned, it is difficult to keep the child's attention, so trying to make these different tests or tasks into games is very helpful. And it is important to also show approval even when they are having difficulty doing these different tasks. Next slide. So the first one is cerebral function. This includes assessing their level of consciousness, orientation, intelligence, performance, mood, and their general behavior. Many of these things can be noted just through conversation, especially their level of consciousness and orientation. And you'll want to note any type of drowsiness, lethargy, or their articulation issues if you notice any. This also includes immediate recall, recent memory, or remote memory. And just to note, a child at 4 years is able to remember 3 digits, and a child 6 years or older can remember 5 digits at a time. This also includes other sensory perception tests. So this picture here is what's called stereocyanosis, and this is the ability to recognize objects by touch. Next slide. Next is the cranial nerve function testing. So it's important to test all of these different nerves as they each have a specific function. To test these are part of our standard head to toe, but some of these include smell, vision, pupillary reaction, eye movement, hearing. You also want to have the patient smile, frown, stick out their tongue, and then shoulder elevation. Next slide. The next test of the neurological exam is the cerebral function test. So this is for balance and coordination. So you're going to observe the child walk. It's best to do this as they're walking into the exam room so they're not necessarily know that they're being watched. You're going to have the child balance on one foot. So a child as young as 4 should be able to balance for as long as 5 seconds. And then tandem walk. So this is a picture of tandem walking where they're putting one foot in front of the other. And then you're also testing coordination by having them touch his or her nose and your finger as you move it. Next slide. Next is testing motor and sensory function. So this can be tested by looking at the different myotone and dermatome patterns. You're also assessing muscle size, strength, and tone, and you want to make sure you're comparing these bilaterally. The sensory system, when you're testing that, they should be able to distinguish light touch, pain, vibration, and hot and cold temperatures. So to test this, you're using a wisp of a cotton versus pressure or like deep pressure of your finger. You're going to use a pinprick to detect pain, and then you can use water bottles filled with different temperatures of water so that you know that they're detecting the different temperatures. Next slide. Then, as we're all familiar with, we are testing the deep tendon reflexes. This is a part of the basic physical exam, but it's also a very important aspect of the neurological exam. Next slide. And then during the physical examination, there are a number of different things that we should be monitoring for. So there's common signs and symptoms of a neurological disorder. So these would be increased head circumference, bulging fontanelles with our much smaller children, unequal size and response of pupils, and unequal globe movements. So when you're having the patient follow your finger back and forth or a light or something, their eyes may shake, and that's what you're looking for. So projectile vomiting, widening systolic and diastolic blood pressure, a decreased pulse rate and respiratory rate, an increased temperature, a headache or pain in the neck, especially with flexion, and spasticity of the muscles. Next slide. We have to pause it for a second, and we're going to have to edit it. I don't have the